Hello, I'm Dr. Michael Steele and welcome to today's video. Today I'm going to be doing part 2 of my brief series on using statins to control cholesterol and why your doctor keeps wanting to put you on the darn things. Today I'm going to be going over my feelings of the guidelines that are out there right now. For those of you who don't know, I'm a currently practicing board and certified internal medicine physician, and the goal of these videos is just to put out some kind of, what I think is unbiased, hopefully trustworthy general medical information. For today's bonus segment, I'm going to be going over how to access my YouTube videos and find them on YouTube. And, nope, never mind. That's not a good idea. Never mind. I will not be making a YouTube video about how to access my YouTube videos on YouTube. We'll just get right to the cholesterol. In my first segment on statins, I just kind of went over the guidelines that came out in 2013 from the American Heart Association, the American College of Cardiology. To summarize briefly, those guidelines say that instead of shooting for specific cholesterol targets, we should basically just match up your risk for heart disease with whether you need cholesterol medication or not. So if you were low risk for heart disease, you should not take any cholesterol medication. And if you are medium or high risk for heart attack or stroke, then you should be on a medium or high dose of cholesterol medication. Now, I do like these new guidelines better than the old ones, and the main reason I do is that I like the idea of making the decision to start cholesterol medication based on risk instead of just based on some cholesterol number. This approach, avoids the situation where, we would have like a young person with a high cholesterol and we would feel the need to go ahead and put them on cholesterol medication, even if they were like in their 30s and they may not have to worry about a heart attack for like 20 or 30 years, which always seemed a little fishy to me. The new guidelines do emphasize that statin medication is supposed to be used in addition to lifestyle measures. So still the very first line of defense in reducing the risk of heart attack and stroke is supposed to be working on healthy diet, regular exercise, getting your weight down to a healthy weight, and then certainly stopping smoking. There's not really much room for debate on what the guidelines say. That's what I went over in the first video, but there is plenty of room for healthy disagreement and debate on whether we should actually do what the guidelines say and whether we should trust what they have to say. Well, if these new guidelines are all based on risk, you may be asking, well, how do I calculate my risk? And it's funny you should ask. Here's a handy dandy webpage you can go to calculate your risk. You can actually go to this website up here on your own if you like, and you can plug in your numbers and calculate out your risk yourself. This gives you your 10-year risk of having a heart attack or stroke or dying of a heart-related condition. You just plug in your sex, your age, your race, your blood pressure. You do need your HDL cholesterol and your total cholesterol, and then you just answer these questions down here, and it bing plugs out this number right here. Now, this webpage is based on what's called the pooled cohort equations. It was criticized initially when the guidelines came out as overestimating your risk of heart attack and stroke, but the ACC and the HA insist that this is actually a validated model. So this brings me to what I do not like about the guidelines and what kind of bothers me. So here I've plugged in some numbers for a theoretical male age 63 who's a Caucasian or white. He has a very good blood pressure of 110, a very good total cholesterol 170, and a nice healthy HDL of 50. He doesn't smoke, he doesn't have diabetes, and he's not on any blood pressure medication for high blood pressure. And you can see his risk up here. His 10-year risk of having a heart attack or stroke is 7.5%. So you may recall in my first video that the guidelines recommend using cholesterol medication if your risk is over 7.5%. So interesting. Basically, a perfectly healthy 63-year-old male is recommended for cholesterol medication. Similarly, if you put in 64 boop, or 65, boop, the risk just goes up. So every single male in the country over age 63 is recommended for cholesterol medications if you follow this guideline. Here you see I've done the same thing with females and you get a very similar result, except the age is a little bit higher. So basically every single female in America over the age of 71 would be recommended for cholesterol medications, even if they're totally healthy. So that kind of strikes me as a little strange to be recommending that everybody just because of their age should be taking cholesterol medication. That just kind of rubs me the wrong way. There was actually a study from Chile where they looked at what happened if you implemented these guidelines across the entire country, and it's like 33% of the entire population would be recommended for cholesterol medications under the new guidelines, and like 75% of people over age 60. Now, I don't know about you, but that just seems to me like just a little overly broad and a little non-discriminating when it comes to trying to decide who should be on cholesterol medications. Just something about that doesn't pass the sniff test. Just smells funny, A few other limitations are that the guideline does not account for family history or chronic kidney disease. So if you do have a strong family history of heart attacks and strokes, you need to keep that in mind if you're kind of on the border. That may push you one way or another. Also, if you go back to that website page and mess around with the numbers, you see that blood pressure has a huge difference on your risk. So if your blood pressure is high by like 10 points when you went to the doctor's office one day because you're a little nervous or whatever, it's going to push up your risk by quite a bit. Now, when I hear there's a guideline that says, yeah, like 75% of the population over age 60 needs to take a certain medication, it does make you wonder, golly, do the drug companies have anything to do with this? I think it's a good question, and really, I don't know the answer. I have read that the ACC and the AHA are partially sponsored by the pharmaceutical industry, and if you look at the authors of the guidelines, several of them do disclose that they work or have worked at some point for the pharmaceutical industry. So it certainly is a valid question. Having said that, the fact remains that there are multiple high-quality clinical studies that show that statins do reduce risk of heart attack and stroke, and I think it would be unwise to throw out the baby with the bathwater and either ignore the statins completely or ignore the guidelines just because there are some lingering questions about the partiality of the authors. By the way, the single biggest and best study of cholesterol medications did not find any increase in non-cardiac death in patients taking statins. So, and there was a significant decrease in cardiac death. So just keep that in mind when you are hearing about all these horrible, nasty things that cholesterol medications do to you. Keep in mind that on balance, they do help you live longer. And I'm going to get into that a little bit more in my next segment. I want to do one more segment where I'm going to go over how to apply this information to you specifically and how you can make a good decision for yourself, accounting for maybe the benefits of statins and the side effects as well. Until next time, take care.